Today we are going to see about hypertension, which is commonly called high blood pressure. Our normal blood pressure is less than 120/80 mmHg. It reaches 140/90 mmHg, or when it crosses it, we call them as high blood pressure. Blood pressure is nothing but the pressure exerted on the walls of blood vessels, mainly arteries. There are two types of hypertension. Essential hypertension is the most commonest one, about 95% of the cases. In this type, hypertension is the main complaint or main disease. The next type is secondary hypertension. It is about 5% of the cases only. In this type, the main complaint is not hypertension. It is some other disease which leads to hypertension. For example, kidney disease or some hormonal tumors like that. But it's 5% only. Next, we are going to see what are the reasons for high blood pressure. Actually, no strong reason for essential hypertension, but there are some theories like it may be from genetic cause or stress or from environmental factors as such. Reasons for secondary hypertension, as I told you earlier, here the high blood pressure is due to certain diseases like kidney diseases, endocrine diseases, that is just hormonal diseases, or vascular diseases, that is disease affecting the blood vessels. This is the classification of blood pressures in regards to hypertension. The purpose of this classification is to assess the severity of the disease and also to choose the correct treatment options. Next, we are going to see about the signs and symptoms of high blood pressure. Actually, there are no specific symptoms for hypertension, but in severe cases, like in malignant hypertension, we can see headache, nose bleeding, shortness of breath, and many critical situations can be happening in emergency conditions. But for mild, moderate conditions, there are no such specific symptoms. You may have a question like, if there are no symptoms, why we should concern about the disease? We should care about the disease because of its complication. If a person is having high blood pressure for a long term, it could damage his blood vessels and heart, because high pressure of the blood may increase the workload of blood vessels and heart, leading to their damages. So complications would be hypertensive nephropathy, where kidney gets affected due to its blood supply damage, and then would be the retinopathy, in which eye gets affected due to damage of blood vessels of eye, and stroke due to blood vessel damage in brain, and heart attack due to blood vessel damage in heart, and also due to increased workload of heart. Now we are going to see about treatment. There are two types of treatment, pharmacological and non-pharmacological. Pharmacological treatment is nothing but medications which are prescribed by your doctor, like beta blockers, ACE inhibitors, sartans, kind of drugs. But we are going to concentrate on non-pharmacological treatment, which is very important and can be done by the individuals. Lifestyle changes are very important in the treatment of hypertension. Even the patient is under the pharmacological treatment, there should be certain lifestyle changes so that the pharmacological treatment will be effective. The main lifestyle changes would be the diet changes, quitting the habit of smoking, increase in physical activity, and reducing obesity if the patient is obese. These lifestyle changes seems to be restrictive, but if we think about the complications of hypertension, you should do these changes. The important diet modification for hypertension would be less intake of salt. Many of you would have questions like why. Please remember the fact that water follows salt. It is applicable for our blood too. Whenever there is increase of salt in the blood, Water moves into blood from the cells and tissues, making the blood volume more, so the blood pressure will also be more. And also, movement of water from the cells and tissues makes the tissues and cells dehydrated, that is less water in the cells and tissues. So due to these facts, there should be less intake of salt in case of high blood pressure. The next diet modification would be avoiding fried oily foods. Why is it so? Because the two important factors for heart attack will be the increased cholesterol level and damage of blood vessels. Due to high blood pressure, there is already vessels damaged. So, if the blood cholesterol level is also increased, the risk for heart attack is further increased. So, fatty and oily foods should be avoided. Not only for hypertension, for most diseases, these foods should be avoided. Next lifestyle change would be saying no to smoke, as smoking will also increase blood vessels damage. The next lifestyle change would be increase in physical activity, that is exercises. Studies show that the physical activity will secrete some blood products which are very protective in nature for the blood vessels. And also, increase in physical activity will lead to reduce in level of cholesterol. So physical activity is very important for the cardiac health, heart health. The next important factor is obesity. Definitely there should be preventive measures taken against obesity, because obesity in recent times across the world not only leading to heart problems but also many problems in human body. Weight loss should be taken into consideration for most of the health issues across the world in recent times. This is all about hypertension. No need to panic about it, because if the blood pressure is in control, there is no complications. And also, the lifestyle changes will play a very important role in the control of hypertension. So if you have any questions or doubts, you can contact me, and the contact details are given in the description. So bye.